It's an essential thing, one of those things that we should all have in our medicine cabinet. This makes it easy. It's one push of a button and it does your systolic, your diastolic, it'll do your heart rate, your date, your timestamp, so all the things you want, and it speaks to you and it's backlit. So you don't have to be a medical professional, you don't have to be a nurse or a doctor to interpret your readings, but it is called the Advocate Speaking Wrist Blood Pressure Monitor, and it's item number V46456. QVC price $38.75, and it's on a sale price $29.95. So you're saving $8.80. Shipping and handling is $3.50. 5 easy pays of $5.99, and we have included the batteries for you, which I always love that. One thing that's frustrating me, get something home and you got to go find the batteries to put it in. But I do love that this is very, very simple. And it's called Advocate, and I love that name because we do have to be our own best advocates. If you do have high blood pressure, then it is recommended by the American Heart Association that you take your blood pressure every single day and test it throughout the day. But the thing about blood pressure is you can't tell by looking at someone that they have high blood pressure. And that's why it's called the silent killer, because nearly half of American adults have high blood pressure with no symptoms. So it could be a very, very dangerous thing. So I'll show you with just a push of a button. And I have mine on silent. So when you push the button, it's going to speak to you and do that whole blood pressure reading. Now, I'm not doing a live reading on my wrist because when you take your blood pressure, you're supposed to sit quietly and uncross your legs, relax your arm, and we've got some great videotape that shows what that live reading looks like. It's about a 40-second process, and I don't want to waste 40 seconds of airtime talking, but here's what you do. You put this opposite a wristwatch, and the little carrying case does a great job of kind of elevating that wrist monitor to about heart's level. That's the perfect ideal height. So you'll push one button as you put this on, and it's going to give you that big reading. The numbers are very big in backlit, but you see that backlit display is a color. It's color coded as well. So if it's backlit in green, that's going to mean you have a normal or an average reading. If it's backlit in yellow, that's going to look like a pre-hypertensive situation. And if it is backlit in red, please, that is hypertension and you must contact a medical professional ASAP. But this is just as essential as your medicine for your medicine cabinet as a blood pressure or as a thermometer and a scale. So if you think of it in terms of something you really need and should have every single day, and things that I didn't know when I started presenting blood pressure monitors was women, once they turn 65, are at a higher risk than men for high blood pressure. And as we age, our blood vessels tend to lose their elasticity, like everything else in our bodies, but that could be a contributing factor to high blood pressure. Also, things like diet and exercise, meds that you may be taking, family history, meds that are contraindicative, meaning if you're taking medicines for colds or allergies, sometimes they cause high blood pressure or interact with other blood pressure medicines. So this stores 90 readings, which is fantastic because when you do go to the doctors or if you are on the phone with medical professionals, you can scroll through these readings and tell your doctor what the numbers were. Again, you don't have to know them, you don't have to interpret them, you don't have to know what's a normal range. And here's what that backlit display looks like. So you've got the green, that's your good. Your yellow and that orange or amber is that pre-hypertension. And red, of course, is hypertension. When you go into your settings, when you get this home, remember, we give you the batteries. You can turn that speaking feature off. In fact, I'll turn this one on so you can kind of hear what it sounds like. And I'll put it up to my microphone and you can hear.
Stay still and do not talk until the measurement is complete.
So there you see, it'll start to take your blood pressure there. That process takes about 40 seconds to do the systolic, diastolic, the date and time stamp, your heart rate, all of the critical information that we need. And why is it important to take this to your doctor's appointment with you? Well, because when we get to the doctor's office, there's something that's called white coat syndrome. And it happens to so many of us, even the calmest of people. What happens is you get all the stress and the anxiety or the pressure of getting to that doctor's appointment. Likely, you're going to have an elevated blood pressure, which might not be an actual assessment of what's going on in your life. So you have this, you go through those readings, the doctor can see what's going on, and if he does find that high reading, He'll know exactly the date, the time, and what was going on. You can explain to him at that point in time. So you got to be your own best advocate. I mean, when you think about our cars or our cell phones, our devices have indicators. They've got low battery. Maybe you need to do an update, or maybe your tire pressure is low in your car. Point being, other things in life have indicators to tell us, or warning signs. But blood pressure, high blood pressure, doesn't come with warning signs for people. So if you have this, this can be that indicator that will let you know, okay, something's going on with me, because you can't tell by looking at someone. So you don't know if your blood vessels are losing their elasticity. You don't know if your diet and exercise situation is causing a problem, or your family history could be causing a problem that needs to be reevaluated or reassessed with your doctor. So we use this in my family. My dad has medical issues from time to time, and he absolutely, it's critical for him on a daily basis to take his blood pressure. So I want to give him something easy, and this is very easy. And when you get this home, you don't worry if you don't remember how to wear it, because right on the monitor itself, there's a little diagram of how to put it on. Also, it comes with a uh, this little indicator card, which I've blown up here nice and big for you so you can see. It just walks you through the process of how to sit, how to put it on, because you do want to follow the same protocol that you would follow in the doctor's office, meaning you need to sit quietly, you need to uncross your legs, give yourself some deep breaths, and relax that arm. Now, when you take it at home, of course, you want to hold this at about arm, or at about the monitor at about heart's level, which that's why this carrying case comes in handy, because you can rest your elbow on a table or the arm of a chair. And simple push of a button, because I will tell you, my dad, my mom, they don't want to be bothered with downloading apps, with multiple things that they have to do and know and remember. So, and I don't either. I'm not a very techie person. So when someone tells me I get an accurate assessment of my blood pressure with one push of a button, and it's going to store 90 ratings for me, I think that's pretty awesome. And it's, again, very invaluable, because we can't tell by looking at another human being, do they have high blood pressure? And it's critical, it's essential, it's the silent killer. That's why it's called that, because it comes with no warning signs. If you have it, you should be testing every day. This will give you that information. You don't have to interpret it. It's backlit. Green, good; yellow, cautionary; and red, you need to call that medical professional. So I'm going to come back with some Tommy Copper things later, but next we have, who do we have coming up? Oh, oh, Devin. Okay, Devin's coming up next.
Hi.
Hi, Devin.
How are you? It's great to see you.